Okay, let's begin. I'd like to first of all offer you a summary of where we are in Clinton County at this point. This is brought to you from the Clinton County Health Department. There's 26 positive cases currently in Clinton County. That's an increase of 2 since yesterday. We still need to do more testing locally, obviously, and but the governor has promised there's going to be a lot more test kits coming out soon. Obviously, most of these tests, the vast majority of them are down in the New York City area because they have the biggest problem at this point. But as they start to reach their apex in the next 2 to 4 weeks, tests may become more available up here. But I do think we're going to start seeing an improvement in testing up here very soon. 92,381 known positive cases in New York State. We used to be half the country, now a little bit less than half the country because the country is really starting to take off. As you know, we're a couple of weeks ahead of the rest of the country down stateside. There's been a total number tested of 238,965, 18,000 more tests administered just in the past day. And of those 18,000 tests administered, we're receiving about I think 8,669 new positives statewide and 2,373 total deaths. 13,383 people are hospitalized, up 1,157 since yesterday. The good news is that there's now slightly more people being released from hospitals that are going into the hospitals, so hopefully that can give them a little bit of a breather room downstate, although we're still exceeding that 1,000 person rate per day going into their hospital system. ICU admissions still continue to trend upward. Governor talked today about reaching the apex, especially downstate. He believes, and you see this chart they produced here, this is the governor's model. He believes that we'll probably reach the apex, mostly downstate, in very late April, early May. Our upstate experience is, as you know, a few weeks delayed from that, so our apex probably won't be reached, I would imagine, until sometime in May. And the other feature that he's now providing us with is notice that after the apex, he says, once we get to the apex, we then have to start coming down the other side of the mountain, and that takes as long as going up. So that's an extended period of social isolation we have to maintain as low infection rate as possible. He also sees that as plateauing for a number of months, right through the summer and into the fall, that we're going to have to maintain our vigilance. And what we're fearful of, as you probably heard, is a rebound set of infections that could occur if we all of a sudden let our guard down and start reinfecting each other. So that's the biggest concern the governor, I believe, has right now, is getting this right, doing the painful things right now, so we can have a better future once we can rid ourselves of this disease. These pandemics come in waves, as you probably have been reading. Spanish flu had 3 waves over a period of 2 years. H1N1 had 2 waves. We're hoping if we can do things really, really well this time, maybe we can get by with 1 wave, but as you saw, even Dr. Fauci is talking about a 2nd wave in the fall, so we're trying to guard against that as best we possibly can. New York share as a total in the country is dropping. 227,061 cases across the nation as of noon today. So we're less than half of what I mentioned across the nation. Things seem to be getting a little bit better downstate, but continue to trend upwards here locally, obviously. But they're getting much worse in the rest of the country. City of Plattsburgh is a little bit unique in that we're the only city in New York State for about 100 miles. You've all heard me say that in one way or another before. And that means we've got a much denser population here than in our surrounding areas. For instance, we're 600 times more dense than the county itself. So we recognize we've got a huge responsibility here to try to manage the density because that's where these viruses take hold. If you look all across the country, they start in dense urban areas, then they start spanning out into the suburbs and into the rural areas. So that's why all cities are kind of ground zero for this. And surprisingly enough, City of Plattsburgh is more dense than the median or average city in the state of New York. So that's what is particularly concerning to me. Just as of a few minutes ago, we hit the 1 million person mark of infections worldwide and exceeded 50,000 deaths worldwide. I estimate that in the United States, we're going to hit the 1 million mark alone in the US probably in about 2 weeks' time, unless something dramatically changes in the interim. You probably saw yesterday that the governor closed New York City playgrounds, but still encourages people to go out and recreate in the open spaces in the parks. We've done the same here. The reason why I don't want our children using playground equipment is that there's no way we can keep that sanitized for them. I don't want a child risking their health for that reason. So please go to the parks, recreate, enjoy yourself, but do it in ones or twos or with your family or household. But please don't use the equipment, and obviously please don't be doing team sports right now, because we can't do team sports and still maintain the 6-foot minimum social distancing. I really am appreciative of the leadership that our governor has shown. He's really making a difference, and we're trying to make a difference here. By us taking his cues and the experience in New York City, I think we've really got a good approach and a much better fighting chance of this in Clinton County than in elsewhere. And I'm grateful for his support in trying to bring the curve down, just as we're trying to do locally here. And I believe we're having some effect, although it can't be even possibly enough for those people who lose sleep every night over this. Our Clinton County Health Department officials that really understand the magnitude of what could have been had we not put many of these practices in place. You know, one of the reasons why we're worrying so much about social distancing is that COVID-19 is a really unusual virus. First of all, for the average person, average infected person will give it to 2.5 people on average. The flu is just a little bit more than 1. That's why it kind of can propagate, but not very quickly. You get it, you pass it to 1 person. This disease, if I get it, I pass it to an average of 2.5 people, unless we can really do a good job with social distancing. And of those 2.5 people that get it, for the first week or 5 to 6 days, they don't even know they have it. Symptoms don't occur, but you can be contagious for 5 or 6 days. Then the people who then, beyond that incubation period, start feeling symptoms, they'll continue to be infectious for a couple of weeks until it's run through their system. But 25% of them won't show any symptoms at all, especially young people. So it's very easy for a young person to feel very invulnerable, that it's not going to happen to them, or if it does happen to them, it's not going to be a big deal. As a matter of fact, a quarter of them won't even know they had it, but they will be passing it on to others. So people have asked me why I decided to do this limited curfew over this weekend. The curfew obviously is put in place right up until Monday night. We expect some warm weather this weekend. It's going to be very enticing for people, especially young people, to go and enjoy themselves, go to gatherings, maybe party a little bit, and we can't afford to have that happen. So I worked with a number of officials and Clinton County Health Department experts to try to craft something that just get people to stay at home for these next 5 days, and that's all an emergency order will last, is 5-day period. I have a lot of exceptions to the curfew. Of course, people need to go to and from work. People need to go and get the food they need, their sustenance, their repairs, etc. People need to continue their education or do their volunteer work. Any essential thing you need to do, please do it. Please do it very carefully. All we're trying to get you to do is to follow the governor's orders to not do any non-essential activity. That was Order 220.10 that you recall he issued about a week or so ago. So let's just get through the good weekend or good weather this week. Just stay at home. Don't infect any others. And let me show you kind of visually why this is important. Let's say 4 people want to go and hang out this weekend, and somehow they infect each other. That's 4 people that then, if for each person who gets infected, they can spread it to an average 2.5 more people. Maybe by Wednesday or Thursday, another 10 people are infected. 4 times 2.5 is 10. And then by the following weekend, another 25 are infected. 10 times 2.5 is 25. So you've got 25 and 10 and 4, all stemming from 4 people who felt they wanted to hang out this weekend and inadvertently infected each other. 39 people, if they receive COVID-19, and if we really have about that 2% fatality rate with this disease, which is what we're hoping for in the United States, maybe a little bit lower. Italy's closer to about 5% fatality rate. Let's see if we can get down to 2% fatality rate. If we have 39 people infected, it's more likely than not that somebody's going to die. So really, we can't figure out a way to not have 4 people not assemble this weekend if it's worth saving 1 life. I think it absolutely is. So I've been taking a little bit of flack for taking this step. I appreciate Senator Little for helping me try to go through all the various processes we've been trying to do for the last couple of weeks. And I appreciate her support. I appreciate all the advice of people that actually asked me to strengthen the curfew even farther. But I know it's in essence voluntary. I don't want any of our police penalizing anybody. I just want them to be going up and down the street saying, come on, go home this weekend. It's really critical. And it's critical because of that graph you saw a moment ago. We're still in Clinton County on that kind of flat part before things really start taking off. Healthcare experts tell us if we would really do this right and everyone just absolutely stays home for 2 or 3 weeks, we don't go up that curve. It stops. So maybe 5 days can make a real difference in slowing down that curve before we go into the exponential part and really things start getting really out of hand. So we've done pretty well in Clinton County. We're about midway in the pack of counties that are suffering from this right now. And I'd like to keep it there. I don't want to be the county that has a death rate that starts accelerating like we see in New York City. And so that's what my efforts are all designed to do. The last thing I want to leave you with is I also ask, I didn't demand in any way, but I asked our public to please wear masks when they're in public. And the reason for this is not to protect yourself. You know, you've heard enough to know that you really need an N95 mask and you need to change that mask frequently during the day if you're really trying to protect yourself from getting infected. Those masks are really for everybody else. Is to ensure that if you happen to be one of those people who are still in that incubation period, that first week, that you're not accidentally infecting somebody else through a cough or a sneeze or saying your S's too much. So masks are designed to protect others, not yourself. And they have an effect. I wear a mask going to and from work now. Not because I hang around with a lot of people at work. As you know, this is a little bit of a ghost town in City Hall right now. But it gives people some comfort. As a matter of fact, when I go by the people in the street with a mask on, you know what they tend to do? They tend to gravitate right to the other side of the street or even to the across the road. And that's a good thing. They want to keep their distance from me. And if I happen to be infected and don't know about it, I'm very glad that they did that because I could be saving a life by not infecting them. So that's the point of masks. They're not mandatory, but boy, I sure advise you to do it. If you're at this supermarket, you see the congestion there. They've got the lines every 6 feet at the checkout counters, but you know when you're rubbing 3 feet between you and the next person between an aisle, you know you're violating social distancing. If we can't strictly follow social distancing, then please wear a mask. Again, not to protect you, but to protect others. To protect that 39th person that might be in a, pardon me, oops, I'm sorry. The 39th person that might be in one of our extended care facilities at Meadowbrook or at Lake Forest or at Russell Long, etc. We haven't had any cases, severe cases in those locations yet, but we know if we ever do, then it's just going to wreak havoc on our most vulnerable population. So think about them. Consider wearing a mask. Consider staying at home if you don't absolutely need to go out. Consider not using the playground equipment. We're not trying to do anything to enforce any of this. We just want to educate you. And I appreciate all the support and the advice as we put these directives out. I'd be happy to answer any questions for you at this time.
So you said that this ends Monday. Do you plan to extend after Monday?
If I'm permitted to, I will, certainly. I think it's a good idea. Again, it's really, in essence, it's an education tool than an enforcement tool. But it sends out exactly the right message. Follow the governor's orders. Only go out if you absolutely have to. And certainly no partying, no social gatherings, nothing unessential. Let's get through this and then go and have a big party in, sometime this summer. But let's just get through this and save some lives.
If people aren't paying attention to the directive now to stay home, and if you do go out, don't go out in large groups, why would they pay attention to a voluntary curfew?
They may not. And we could put teeth into it, and I think there's going to be that 1 out of 10 that's just like you suggested, that said, I'm not going to pay attention to this. I've been cooped up too long. It's a nice weather outside. I'm going to go and enjoy myself with all my buddies. But if we can make a difference for the 9 out of 10 that said, yes, officer, yeah, thank you for reminding me. Thank you for worrying about my health and telling me it's probably best I just go home. I'm worried about the 9 out of 10. Maybe we'll never get through to the 1 out of 10, the invulnerables. But if we can make 9 out of 10 change the behavior a little bit and stay home to save a life, then it's all worth it, absolutely. But you're right, we're never going to have 100% compliance, absolutely. We see a lot of people out in the streets right now vandalizing our neighborhoods, and we're seeing petty crime and all that kind of stuff increasing dramatically because our police are out there trying to keep us safe, and they aren't able to then go and track down all the people that are committing these crimes. But it's a priority to save lives right now. We're not going to get to everybody, but if we can get to 90% of the people with these gestures, it's well worth it.
With this being voluntary, what have you advised the city police department on how they should handle the curfew?
Just that. I just spoke with the police chief a few minutes ago, because it doesn't actually come into effect at first until tonight at 8 p.m. And I asked them, just make sure your officers, if they see a group of people congregating, get on your PA system or get out of your vehicle. I don't want our officers to go near the individuals either, because they need to be protected as well. But just tell them, come on guys, just go home. Just go home. There is a curfew. We're not going to write you a ticket, but please just go home for your own safety. So the officers can play a really important role right now in educating the public just at how serious it is. And ultimately, people want to do the right thing. If you were inadvertently, getting together with some of your friends and hadn't really thought too much about this and didn't have any immediacy, and you're walking to a gathering to have dinner somewhere all together, and one of our police officers rolled down the window and said, come on, I just need to go home. This is important. You would, right? I would. Most people would, but some won't.
I've watched Eurovision News, which my provider is during this period of time offering. And they've tried, I guess, voluntary compliance, didn't work. They're now doing mandatory compliance and actually fining people. Would you, if this doesn't work as a voluntary situation, consider extending the curfew and including fines?
I think you're referring to France has literally written millions of dollars of fines because people aren't cooperating, and people are getting arrested there. I don't think that's going to be necessary here. We don't have the extent of the problem. We're trying to make sure we don't get to that point. I think people will be compliant. If the public health department says this is just not working, and if the governor imposes a shelter-in-place order that says people have to stay home, absolutely, we'll do whatever we can to follow the governor's orders. Absolutely, we will. But I don't think it'll have to come to that. I think everybody wants to do the right thing. They just need to be educated a little bit of just how serious this could be. And the funny thing of this, I'm absolutely sure that because of the things that we've done in the city of Plattsburgh, people's lives will have been saved. There's no doubt about that in my mind and in the minds of the public health experts. But you're never going to know how many people's lives were saved. All you knew is, what a hassle, I got to stay home. Or what a hassle, the cops just told me I have to go home, I shouldn't be on the street here. But ultimately, those who really know the numbers know that lives are being saved and know that the calculation is worth it for a little bit of inconvenience, or maybe even a lot of inconvenience. but for hopefully as short a period of time as we can possibly muster.
Is there a reason why it's only in place up until Monday?
I'm only allowed to put in emergency orders for 5 days at a time. And I then consult it near the end of that 5 days to renew it, to add something to it. It took a long time for me to get this one out because I had to talk to a lot of different people. Most of the people actually said, make it stronger, kind of along the lines of what you might have suggested. But I thought it was worth trying something that was pretty much voluntary. I mean, it's got the mandate of an executive order, an emergency order, but as you know, we don't want to penalize, we want to educate. So if at renewal time, a lot of experts say that you need to renew it and you need to strengthen it more, etc., and I can get agreement on that, yeah, I would definitely renew it. Like I say, a little bit of convenience, if we can save just one life of your grandmother or your grandfather, that's priceless.
So Town Supervisor Michael Cashman sent out a statement saying, you know, he's also working with the County Health Department, State Health Department, Governor's Office, kind of all the same people I'm assuming that it is you're working with, and they never got the recommendation for a curfew. There's no curfew there. So I guess kind of where's the difference between the two? Why do we need one here but they don't need one in the town?
Well, the town's a lot less dense than us. We're 600 times the average density compared to the rest of the counties. We've got very different challenges here. We've got sidewalks where people go. We've got the student population where people congregate and party. We've got the parks and the civic areas and the government centers, et cetera. So we're in a very different position. But also the governor talked in his press conference today about he believes there may be needs for curfews. And he says this is something that really needs to be discussed at the local level. Well, there's nothing to me more local than my city and trying to protect it and making sure we don't start creeping up the exponential part of the curve. So I believe, just like very quickly after we imposed closed our gym and closed our crate center and our library, other areas, including the state, followed within a day or two. When we sent our people home, state followed within a day or two. Circumstances are different elsewhere. We've tended to be a little bit more early in some of these things, but you know, and a lot of people are going to accuse me of doing too much too soon, but I'd rather do that than too little too late, especially when lives are at stake. So we're in a different circumstance here. We're more dense than the average area, certainly more dense than the town. Certainly the town is juggling and worrying about all the people that need to use their shopping areas, et cetera, and all the sales tax revenue that may flow from that, et cetera, that all the municipalities depend on as well. They're doing a different calculation, but I felt that this is right to send out this educational message to our residents. And by the way, as you know, I'm getting some heat for it, but I'm also getting calls, and you probably wouldn't be surprised to know who the calls are from. They're from people in their 60s, 70s, and 80s saying, thank God, I've been worried sick. Why haven't you done this earlier? That's who I'm listening to.
The recommendation, it's not part of your order, but the recommendation to wear masks in public. A lot of the healthcare workers have been worried about supplies. Masks have been a big issue. Why recommend to the average person on the street to wear masks when they're still worried about the supplies to our healthcare professionals? Excellent question.
And you know, the masks that the healthcare professionals are referring to are the N95 masks. And we need to preserve N95 masks for them. And those masks aren't designed to protect the public, it's designed to protect the healthcare worker. They're working with people that we know are infected. So they need an N95, a very specific mask or respirator to keep them safe so they can stay healthy, so they can help others in the hospital. The mask I'm referring to is, you know, the mask I wear, a woman sewed them locally as a volunteer gesture to help out essential workers in the city. Your mask might be just a bandana or a scarf. It doesn't matter what it is. It does not need to be an N95 mask. We're not trying to protect you. We're trying to protect somebody who you may come across if you don't know you're infected, so you're not sneezing or coughing or essing out on them. So it can be almost anything that's going to stop you from infecting others.
Well, that's the other thing that I had a question about. You know, like a lot of crafters have been asking, well, gee, can I knit one, or can I do something like that? And the recommendation from some people is no, because the weave is not tight enough. How, you know, when you say, well, just wear a scarf, well, some scarves have a very open weave. Isn't that, you know, shouldn't you be a little bit more specific on what people should choose to wear if they don't have a mask?
Yeah, I'd be very grateful if everybody could have access to an N95 mask and then protect not only everybody else, but them at the same time. But as you know, they're not available. And we don't want to be taking those masks away from the people that really need them, right? So now there's been a lot of change in evolution in the way of thinking of these masks. As you've been probably observing, Dr. Fauci is now recommending you might consider wearing a mask. Whereas a week ago he said, I didn't think at that time it made sense, because he's very worried about what you said, taking those N95 masks away from the healthcare providers. But anything that stops you from perhaps infecting others is a good idea. Now, if we could all maintain perfect social distancing, masks would be irrelevant, because remember, they're not designed to protect you, they're designed to help you protect others. So anything you can do through social distancing, wearing a mask if you can't maintain social distancing, for instance at the supermarket, just putting your hand over your mouth, etc., when you're talking or sneezing, or your arm over your mouth if you're going to sneeze. Anything like that obviously is going to help. So I think there's been quite an evolution of thinking about masks or protection in the last few days. People get more and more concerned about the social distancing and looking at more and more measures we can take. The one graph I didn't show you is that when we look at the experience elsewhere, South Korea did it pretty well. They went up, they peaked, they kind of leveled off. Taiwan, up, Hong Kong, up, peaked, leveled off. Italy, not so well. Spain, not so well. Europe, not so well. But the area that's doing the worst in terms of comparing when the first 100 people were infected on, when, in other words, when things started rolling on, the worst place pretty much is the US. The US is continuing to take off, where others are starting to level off. So we need to do more. We absolutely need to do. Germany did an excellent job, by the way. Germany is probably one of the most successful. Started off just like us, and they leveled off very, very quickly through extreme measures. We in this country have a hard time doing extreme measures. Still people who live in Long Island who figure that they'd rather go up to Plattsburgh to visit for a little while. And how are we going to really stop them, right, in this country that values its freedom? I don't know if we can. And, you know, that's an issue in itself. But it really does make a difference doing absolutely anything we can. Nobody's going to argue that a mask isn't effective. We may simply argue about how effective it is. So anything anybody has that could be an idea to protect Clinton County residents, we certainly want to hear them. Any other questions? Well, thank you very much. You all stay safe. Wear a mask. They're very simple.